Okay, welcome everyone. While we're waiting for the audience members to all get logged in, I just want to go over some administrative details with you. We have quite a large audience today, so bear with us while everyone gets logged in. Everybody will be in listen-only mode, and we will stop periodically through the presentation to allow you to ask questions. So as you're listening and you think of a question, please just go ahead and type it into the little Q&A button, the box at the bottom of your screen in your toolbar, and that will allow us to field those questions as they come in. And we may wait till a certain point in the presentation to start asking questions, but just go ahead and write them down as you think of them. For those of you who are not familiar with the Fenway Foundation for Friesian Horses, we are a nonprofit 501c3, and we're based just outside of Appleton, Wisconsin in the United States. We're dedicated to preserving and enhancing the longevity and health of Friesian horses through three primary focus areas: rescue, research, and education. And today we have a very important educational webinar for you on the aortic rupture in Friesian horses, presented by Dr. Veronique Sy and Dr. Gunther van Loon from Ghent University in Belgium. Dr. Sy graduated from Ghent University in 2007, and in 2008, she began working at the Lab of Veterinary Pathology of the Faculty of Veterinary Medicine, Ghent University. She completed her residency in veterinary pathology in 2010, and then stayed on in the Lab of Veterinary Pathology as an academic assistant, where she combined both diagnostics and her research. In 2016, she completed her PhD on the phenotypical characterization of aortic rupture in Friesian horses. She has authored and co-authored multiple research publications, mainly focusing on Friesian horses, and in 2001, she became a diplomat of the European College of Veterinary Pathologists. Dr. Sy currently works part-time as a virtual and anatomic veterinary pathologist at IDEX, and part-time as an assistant at Ghent University's Faculty of Veterinary Medicine. She has a special interest in Friesian horses, as her family has been breeding Friesians since she was a very young girl. And Dr. Sy has also been a board member of the committee of the Belgian Stud Book of Friesian horses since 2019. Dr. Van Loon graduated from Ghent University in Belgium in 1992 and has worked at Ghent University's Department of Large Animal Internal Medicine ever since. In 2004, he became a diplomat of the European College of Equine Internal Medicine, and in 2011, he became an associate member of the European College of Veterinary Diagnostic Imaging. In 2001, he finished his PhD on atrial pacing and experimental atrial fibrillation in equines. He is the author or co-author of more than 200 publications and 24 book chapters, and has given about 250 presentations at the international congresses. In 2015, he received the British Veterinary Association Award for Clinical Research, and he was also awarded the prestigious Merrill Applied Equine Research Award for Outstanding Research regarding Advances in Equine Cardiology, awarded by the World Equine Veterinary Association. Dr. Van Loon is currently at the head department of Large Animal Internal Medicine at Ghent University, and he's also the head of the Equine Cardio Team Ghent. He's also past president of the Belgian Equine Practitioner Society, and his major interests are in the field of equine internal medicine, especially all aspects of cardiology, vascular diseases, and thoracic and abdominal ultrasound. So I would like to now turn our presentation over to Dr. Sy and Dr. Van Loon. Welcome to both of you, and thank you so much for being here with us today to present such an important topic to Friesian owners.
Thank you very much for this introduction, and I would like to thank Fenway Foundation for the invitation to talk about this topic. I think it's a very important topic for Friesian horses, and together with Veronique Sy, we have been looking at this disease for almost 15 years now, and we like to share our current thoughts about aortic rupture in Friesian horses. We are both from the Faculty of Veterinary Medicine in Belgium, and Belgium is actually known about this Belgian beer. So we even have a town here in Bruges where the Belgian beer is flowing through pipelines in the city. So it's something we are proud of. And of course, we are also proud of the breeding of horses. A lot of horses in Belgium, actually. We are with 11.5 million people, and we have 536,000 horses. So it is a very important industry in Belgium. On the picture here, you see the Faculty of Veterinary Medicine with all buildings on the right side are the clinical services. A very large part of that is dedicated to horses and large animal. We have about in between 5,000 and 6,000 horses a year that come into the clinic. In the internal medicine department, we have about 2,400 horses every year that are being examined for diverse reasons, but cardiology is one of our strong points in the clinic. Veronique is located in the pathology department, which is here at the end of this small lake that we have. So today we would like to talk about aortic rupture and aortic fistulation towards the pulmonary artery. So what I would like to do is first talk a little bit about the circulatory system. What is the aorta? Where is it located? And also what happens when the aorta ruptures and when an aortopulmonary fistulation occurs. How can we see it? How can we make a diagnosis? What will a vet do to make the diagnosis? And then, of course, we want to share our current knowledge on research and ongoing research, and that will be covered by Veronique. So first about the circulatory system. So in very simple terms, the circulatory system with the heart in the middle consists of two separate ways. So on the one hand, we have everything in blue, which is the venous circulation, and the venous circulation is characterized by a low oxygen and a low pressure of the blood. Now, the venous blood comes from the body and goes towards the heart, and the right heart will then pump the blood to the lungs. In the lungs, oxygen is pushed inside the blood, and then the oxygen-rich blood will go back to the heart, and the heart will pump this through the aorta, the major artery in the body, will pump this blood towards the body. Now, this blood, everything in red, is arterial blood and is high in oxygen, and there is a high pressure in the arterial system. And that is very important. The difference between the two systems is the oxygen and the pressure. Now, the problem that can occur in Friesians is actually located in between these two big vessels. So the aorta, which is high pressure, high in oxygen, blood that goes out of the heart towards the body. And then the other big vessel, which is the pulmonary artery, this is the low pressure, low oxygen blood that is pushed away towards the lung. Pulmonary artery, aorta, essential in the diseases that we will see in the horses. Of course, the circulatory system is much more complicated. We see on the one hand, we have all arterial vessels in red, so with the high pressure and the high oxygen. And we have the whole venous system in blue with the low pressure and the low oxygen and the lungs in the middle. Now, very important for our clinical science and for the diagnosis and examination of the horses is things that we can see near the head, so mucosae, and we can palpate the arterial pulses around the head. We can also identify important blood vessels in the neck, so arterial vessels and venous vessels. And then, of course, the heart. We have very important examinations, of course, of the heart itself by auscultation, by echocardiography, for example. Now, the examination of the circulatory system, there are a number of very simple routine things about the circulatory system in every horse that we will check. And one of the things is the jugular vein. The jugular vein is the blood vessel where medication is, for example, injected or where you get a perfusion. And we will always occlude the pulmonary vein here, down, ventrally in the neck, to see if the blood comes into the vein. As soon as you release pressure, all the blood should directly run out of the vein and go towards the heart, and the vessel should be empty again. You should never see this dilated vessel without you occluding it. And I will show you later on abnormalities. We can look at mucosae that we can identify at the gums here, and we will always put some pressure on the gums so to push the blood out of the gums and then release it. And within 1 or 2 seconds, the initial pale color, because you pushed on it, will go away and will turn pink again. And this is the capillary refill time, and that should be normally less than 1 or 2 seconds in a normal healthy horse. So as soon as you release pressure, you will see that the white gums immediately become pink again, and that is normal. We also look at the mucosae at the level of the eyes to see if there is any pale mucosae or any congestion that might indicate a circulatory problem. Palpation of the arterial pulses can be done here at the facial artery, which is medial to the mandibula, and it can also be done here at the level of the transverse artery. And what we feel is actually the difference between the peak systolic and the lowest diastolic pressure, and this is the arterial pulsation that we can feel, and that also gives an indication of the condition of the circulatory system. And then we can also take a blood pressure measurement with a cuff around the tail. Now, this is less accurate than it is in human medicine, but it is still a help in some cases. So that is also something non-invasive that can be done. In horses, but we have to realize that it's not as sensitive as it is in human medicine. Now, something about blood pressure. One of the characteristics of blood pressure and the whole arterial system is that here you see a tiny piece of aorta of an adult horse, and we just blow air into it, and you can see how it can expand. There is an enormous expansion possibility because it is so elastic. And this is actually a very important point of the arterial system. As soon as the blood is pumped out of the heart, and you have to know that with each heartbeat, there is about 1 liter of blood pushed into the arterial system. The arterial system will dilate, and it will actually take part of this energy in this dilatation. And so the blood is pushed into the arterial system, but the forward blood flow is actually being maintained by the fact that initially the arterial system dilates, and then afterwards it gradually collapses again, and this results in a continuous blood flow. Horses have a low heart rate, so about 30 or 35 per minute. So if this would not exist, it would mean that you have a very strong pulse of blood, and then everything stops until you have your next your next heartbeat. So this recoil and this elasticity of the arterial system is a very important characteristic. Now, I show you already a little bit of research. We have identified in Friesian horses, and this was based upon ultrasound carried out in living horses. We've seen that actually this recoil and this elasticity of the arterial system is less in Friesian horses. They have stiffer blood vessels, and these stiffer blood vessels actually make that the blood pressure in horses is higher. So they have a higher, stronger pulse in the arterial system. And this is also thought to contribute to the problem of aortic rupture or aortopulmonary fistulation. So, but remember, this recoil is this elasticity of the blood vessels. Veronique will come back to that. It's an important characteristic. Okay, so we were looking at the circulatory system. We were palpating the pulses and looking at the gums and the mucosae. Another important part of it is, of course, the auscultation of the heart. Super important. We will identify with auscultation the heart rate, but also the heart rhythm. Is this rhythm regular or irregular? Is it slow or is it high? If we think we find abnormalities, we will do abnormalities in the rhythm. We will do an electrocardiogram, and with this electrocardiogram, we can see the electrical activity of the heart, and this helps us to identify the type of irregularity. In addition, with the stethoscope, we will hear cardiac murmurs, so we can hear whether there is a valve or somewhere a leak or something abnormal that provokes this cardiac murmur. And then I think the most important tool for the examination of the cardiac system is cardiac ultrasound, or another name, echocardiography. Echocardiography allows us to visualize the heart, and you can see here the right atrium, the right ventricle, left atrium. We can see the valves, we can see the size of the heart, we can see the size of the blood vessels. we really get a huge amount of information from this cardiac ultrasound. And there are a lot of normal and abnormal images and normal standard views that we will take. But one of the views specifically for Friesians, and these are not standard views, these are special views, are the views where we try to visualize pulmonary artery and aorta together. And this is an image taken at the left side, and you see here the pulmonary artery runs towards the lungs. Here are the lungs, and here is the aorta on a cross section. And you see at this location on the left side, we take the image over here. At this location, the pulmonary artery actually is lying against the aorta, and this location is super important because when Friesians rupture, they rupture over here. So this is an important image, and it's not a standard image during a standard ultrasound examination of a horse. So it really requires special images in Friesian horses. Now, what happens actually with the aorta in Friesian? So I told you already, we have the blue circulation, the red circulation, we have the pulmonary artery and the aorta that are located close to each other. This is where it all happens. This is where it can go wrong, in between aorta and pulmonary artery. This is how the heart looks inside a horse. You see it's a very big organ, and in red we see the arterial system with the aorta over here, and in blue we see the venous system with the right heart and the pulmonary artery over here. So this is pulmonary artery, this is aorta. And if we look now more in detail, then we can see the nice separation of pulmonary artery and aorta. They are located close to each other, but look, we can look in between them, and they are nicely separated, except for one tiny connection, but this is actually the ligamentum arteriosum. And this is not a connection with blood flow. It is closed in an adult horse, so immediately after birth, this becomes a ligament, but actually during the during the fetal stage, we have a connection, a normal natural connection between pulmonary artery and aorta, but this has to close immediately after birth, and then it becomes just a ligament. Yeah, so this small opening closes and becomes the ligamentum arteriosum. And so Friesians that rupture their aorta rupture the aorta near the ligamentum, but important, not the ligamentum itself. It's next to it. It's not ligamentum. It's not the ductus arteriosus that remains open or something like that. No, it's a rupture in that neighborhood, but not at the ligamentum arteriosum. Now, you will hear a lot of terminologies regarding the aorta, and it's sometimes a little bit confusing, so I would like to explain those. So let's say that this is the normal aorta. It's a tube. It's a regular straight tube for the blood flow. Sometimes people talk about aneurysm. An aneurysm means that you have a dilation of your blood vessel, but look, the wall itself is intact. It's dilated, too big, but it is intact. This is not what we see in Friesians. Some people talk about aneurysms in Friesians. It's not an aneurysm. What happens in Friesians is actually that the wall starts to tear. There is initially first a small tear on the inside of the wall. And what can happen, not always happens, but can happen, is that due to the small tear, blood will get in the middle of the wall of the aorta. So you get the different layers of the wall that become separated. And this is what we call a dissection, because the different layers of the wall get dissected and blood will accumulate in between the layers. This can happen in Friesian horses. So blood gets in the wall of the aorta. But more commonly, we see that an aortic rupture occurs. Now, if an aorta ruptures, it means that the blood can suddenly flow out of the aorta into the thorax. If everything ruptures, if the full wall thickness ruptures, if that happens, this gives an immediate loss of any blood pressure because everything is released into the thorax and the horses die immediately. And these are the horses that can be found healthy in the evening and dead in the morning in the box. And this can be an aortic rupture, a full rupture that blows into the thorax. More commonly, however, we see that actually the outer layers of the aorta still capture the blood. And so that you get blood accumulation outside the wall, but still contained in the outer layer of the aorta. And what you get in this situation is actually a kind of hematoma and a blood accumulation around the aorta. Now, if you look from the outside at the aorta, and you just look from the outside, you see a bump on it. So you think, oh, this bump, oh, it's maybe an aneurysm. But if you cut inside it, then you see that it's actually an hematoma. And therefore, it's not a true aneurysm, where you get this situation, but we call it a pseudoaneurysm. It looks a bit like it, but it is not. It is a rupture of the wall and a hematoma that is being formed. So a hematoma on the outer layer of the aorta. Now this hematoma, or also the situation here with the dissection, can be localized on one point, but it can also travel down the aorta over several centimeters, 10 centimeters, 20, 30, 50. It can travel down a very long distance in the aorta, and then you get a kind of blood cuff around the aorta. So that can be this situation. Most commonly, however, we have something very, very special. It is actually a rupture of the aorta into a pseudohematoma, and then in some or other way, we don't know exactly how, but this hematoma connects to the pulmonary artery, because the location where it occurs is where aorta and pulmonary artery are very, very close to each other. So when you get this pseudohematoma, it is actually in contact with the pulmonary artery. And in some way, we don't know exactly if it is due to friction or due to other mechanisms. This hematoma can rupture into the pulmonary artery. And then we get something very specific and very typical for the Friesian horse. We get a fistula. A fistula means a canal between the two that connects the two. So we get a connection between aorta and pulmonary artery. So an aortopulmonary fistula. Yeah, and most commonly we see that we have a rupture of the aorta. We see a blood accumulation in between the two, so a hematoma, sometimes two hematomas, and then they rupture inside the pulmonary artery. And typically this occurs at a very specific location near the ligamentum arteriosus, so close to it, but not at the ligamentum arteriosum. So this is actually something special, because if we compare the Friesian horse with other horses, for example, a warm blood horse, we see actually, if you look at the pulmonary artery and the aorta, we see the Friesian's rupture over here, quite distal. The valve is located here and it's quite a long distance away, while the other horses rupture over here, close to the heart, actually at the level of the valve. So this is something different. Other horses have an aortic rupture at the base of the heart, at valvular level, while Friesian horses rupture more distally. So that is really a distinct difference between the two, distinct condition. Now, what happens if the aorta ruptures? So when it ruptures, it can rupture directly into the thorax, sudden death. Immediately a horse collapses and dies within seconds or minutes, because you have no longer blood pressure, unconscious, and you will die. So it's often in this situation a fatal condition if it ruptures into the thorax. When it doesn't fully rupture and you get this hematoma around the thorax, or you get this aortopulmonary fistulation, you get different signs. These horses are painful. They feel the pain in the thorax, and actually they start showing colic signs. So very often these horses are admitted for colic, and they have a high heart rate and also a high respiratory rate, and very easy you can misdiagnose this as being a colic. And many horses have been put on a table for a colic operation, and actually the initial problem was the aorta. So we need to look carefully for it. Of course, not every colic in a Friesian horse will be this problem, definitely not, but we have to take this into our differential diagnosis. Colic because of pain in the thorax, tachycardia because of the low blood pressure And because of the pain, and tachypnea, we've got because of the volume overload of the lung, all the blood goes into the pulmonary artery and goes towards the lung. And of course, also because these horses have low blood pressure, low oxygen, and they have a rapid respiratory rate. Because all this blood is flowing from aorta towards pulmonary artery, you get an enormous blood overflow in the pulmonary artery in the lungs. You get lung edema, but you also get this right heart failure because you have all this blood sitting there in the pulmonary artery, and the right circulation, so the blue circulation, which is made for low pressure, cannot handle this high pressure. So you get problems with ventral edema, lung edema, also edema at the intestine. So some horses get diarrhea because of this edema. You get jugular pulsation, and that is also something very specific. These horses often have a pulsation in the jugular veins. Look at this horse. We got a lot of ventral edema. Look at all the fluid here under the skin, under the belly, typical location. Also at the scrotum, you often see that there is edema present. These horses can also have intermittent lameness, sometimes fever. One of the things that is always very typical is they keep on having a high heart rate. So even if they stabilize, and look at these horses, they're happily looking around, it has a heart rate continuously of 60 or 70 or more per minute because it has these abnormal blood pressures. And look at the jugular vein, this pulsation. If you see this pulsation in the jugular vein when the horse's head is up, then that is abnormal. When the horse's head is low, then you should not look at it. But when the horse's head is up, it should not get halfway the neck. And that is a very, very important clinical sign. You should not get this jugular pulsation. It means that you have right heart failure. So you see, you've got super acute clinical signs, you've got the acute clinical signs, the subacute clinical signs, and sometimes these horses survive for a prolonged period of time, and they are then in the chronic phase where they are still diagnosed with often the jugular pulsation, often edema, but also tachycardia and of course performance loss. They are no longer able to do physical exercise, and they have a loss of performance. Now, how should we further look at these suspected cases? I already told you that we should look at the pulsation. This is not a Friesian horse, but at the pulsation in the neck when the horse's head is up. You see this pulsation here. You should not see this pulsation. That indicates, so dilatation and pulsation indicates that there is usually a right cardiac failure. So we can see spontaneous pulsation. If you see it very low here ventrally, that is acceptable. But with the horse's head up, it should not get halfway the neck. That is abnormal. And then the second one is palpation of the arteries here in the neck, the carotid arteries. If you palpate them like that, you will feel a very strong hyperkinetic pulsation in the neck, which is also very often found in these Friesian horses. Blood pressurements can also be done with the cuff on the tail, where we will get low diastolic and low mean pressure, so that can be a help. But remember that the measurement is not super accurate, but we will find abnormalities. And then, of course, the auscultation. So if you look further specifically for the heart function, we will start with auscultation. In Friesian horses, we will get high heart rates, usually a regular rhythm, and usually the murmurs are only soft or even absent. And that is very weird. We have a big communication, we have a big opening in the aorta, and still the murmur can be very soft and very, very difficult to diagnose. So for me, this is not an essential criterion, although you would expect this with a rupture. But the reason is that the rupture is sometimes so big that the murmur becomes very, very soft and difficult to identify, or can be absent. Besides the heart, we will then, besides the auscultation, we will then move to more advanced techniques. And I can already tell you, MRI and CT, the horse's heart doesn't get into a CT, so we cannot use these. More in and electrocardiography, I told you already, it's important for rhythm disturbances, but in Friesians, usually we get high heart rates, but a regular rhythm. So it can be helpful to confirm that the rhythm is actually regular and that it is of normal morphology and normal origin within the heart. But of course, these horses do have high heart rates. And the next advanced techniques are the most important ones, the echocardiography, and sometimes in specific cases also catheterization can be helpful, but echocardiography is actually the most important one. So remember, we were talking about this connection, the aortopulmonary fistula. How can we see this? Well, we will try to identify the rupture of the aorta. We will try to identify the hematoma around the aorta, so the pseudo aneurysm. That's an error here, sorry, pseudoaneurysm, it should say. It's a hematoma on the outside of the aorta. We will also try to identify the opening and the rupture towards the pulmonary artery with pulmonary artery turbulence. The turbulent flow we can also identify. And the most easy sign to identify on echocardiography is actually pulmonary artery dilatation. Why will it dilate? Well, because the pressure becomes enormously high, and this system, the blue system, is not made for a high pressure, so you will get an enormous dilatation of this pulmonary artery. Now, the problem for ultrasound is that Friesians are first not very easy to examine because they are quite robust, quite big thorax, big heavy animals, so they are quite difficult to ultrasound, and the images that we have to take are specific images, not routine images, and they are more difficult to take just underneath the lungs. So technically this is much more challenging, especially in a Friesian. But remember, we need specific cardiac images to visualize the rupture. And I give you here, I will not go too much into detail about this diagnostic techniques because it's quite complex, but these are a few examples. And here we see a Friesian heart with an aortopulmonary fistulation. And here we can identify the left heart and the aorta and the pulmonary artery. Now, the pulmonary artery should always be smaller than the aorta. And look at the size of the aorta, which is much smaller than the pulmonary artery. This is a routine image, and this could help you to make the diagnosis, the big pulmonary artery. Another image of, also taken of the right side of the horse is an image where we can see right atrium, right ventricle, so the right heart, and then the blood through the pulmonary artery. And we compare the size of the pulmonary artery over here with the size of the aorta. Look, what a tiny aorta and what a big pulmonary artery. Also a very typical clinical sign that we can identify. But remember, not every Friesian is so abnormal as this image, so it can be much more subtle on your ultrasound. And then we will try to identify the pulmonary artery and the aorta on the left side. This is the image that I showed you before, where I told you that the pulmonary artery is curling around the aorta in the middle. And this one is super important because at this location, here you see a normal horse, and we've published these images in this publication here 4 years ago. So on this image, we can see the pulmonary artery and the aorta, and we can see in a normal animal, it nicely lies around the aorta. Look now in the Friesian with the aortopulmonary fistula. It becomes very complicated. We have a big pulmonary artery located over here. And we have difficulties identifying the aorta, which is lying here in the middle. Now look at this horse. We see here a rupture of the wall. That's already a critical sign. The rupture of the wall into a pseudoaneurysm, one pseudoaneurysm and a second pseudoaneurysm over here. And from here, it goes from aorta to pseudoaneurysm, and then it ruptures here inside the pulmonary artery. So this is actually the critical image that allows us to make the diagnosis, but this is not a routine image. And at this location, we will do color flow Doppler And this is an affected Friesian where we see again the the aorta and the pulmonary artery that goes around it with the pseudoaneurysm. And you see all this turbulent green flow is actually blood from the high pressure aorta that is being pushed inside the pseudoaneurysm and inside the pulmonary artery. So this is the big connection, and this is an image that confirms the diagnosis of this disease. Now, I told you already that it's not always that easy in Friesian horses, especially when they are heavier. Then it is sometimes quite challenging to visualize it. And there are some other things that might help us. And one of the things is performing ultrasound measurement of the flow in the carotid artery. The carotid artery was the vessel that we could see in the neck, the arterial vessel that we could see in the neck. And if we measure the blood flow, we see the peak blood flow with every cardiac contraction. But it should always be positive flow, so above this line, because it should always be a blood flow that goes to your brains, to your head. But what we see in Friesians with an aortopulmonary fistulation is that they often have this negative flow in the carotid artery. So you get during a cardiac contraction, the blood is pushed towards the head, but because there is such a big hole in the aorta, as soon as the heart relaxes, the blood just comes back to the heart and it leaks towards the pulmonary artery. And you see this blood flow going up and down and up and down. This negative flow should not occur in a healthy horse. So that is also a help for us to identify a possible aortopulmonary fistulation. Another possibility is intracardiac ultrasound, a technique that we do more and more. What we do here is we actually have a tiny ultrasound probe, very tiny, on a tiny wire, and we can introduce it into the jugular vein, so the venous system, the blue system, and we can go towards the heart and do ultrasound from within the heart. And of course, if you have an animal that is very heavy and big and difficult to ultrasound, then this can be a help for the diagnosis, as you can do the ultrasound directly in the heart. And then the last technique is an invasive technique, but very efficient to confirm the diagnosis. If it is very difficult to have your diagnosis, you can still use a catheter, a long catheter of 1.10 meters that you drop down into the venous system, so the blue low pressure system, with low oxygen. And you go down the vein towards the heart and you follow the flow towards the lungs. And what you see in the blood vessel towards the lungs, so the pulmonary artery, it should all be low in pressure and low in oxygen. And what you can do via this catheter, you can measure blood pressure, and you can also take blood samples in the vein, in the right heart, in the pulmonary artery, and you can measure the oxygen and you can measure pressure. And what you see in these horses with an aortopulmonary fistulation in the pulmonary artery, the pressure suddenly becomes very high, higher than normal, and also the oxygen becomes higher. There is no way that oxygen can become higher in the pulmonary artery except when you have a connection between the two systems. So that is also a good way to confirm the diagnosis. But it can be challenging. Be aware of it, it can be challenging. And then treatment, well, there's not so much to do. We have to avoid every effort, horses at rest, keep them calm, be aware of a dangerous situation, because if it suddenly ruptures, the horse can drop dead, and it can be a dangerous situation for the horse, but also for the handlers. So we also have to avoid high blood pressure, so any kind of stress or whatever should be avoided. And then medication, well, there's not so much we can do, actually. We can give some supportive treatment, and we can think about, for example, digoxin to increase the cardiac contractile function, but actually it is not there is no problem with the cardiac contractile function. So I question whether this has a beneficial effect. It might help a tiny bit, but not so much. And then usually with any kind of edema and congestion of the venous system, we will give diuretics. But of course, in this situation, there is an aortic rupture. And if you give diuretics, you decrease the blood volume, you decrease the circulating volume, and these animals already have problems with their blood pressure. So actually, it's good for edema, but it's contraindicated for blood pressure. So actually, I don't think we should use these products. At least I usually do not use them, or only use them in limited doses or for a short period of time. ACE inhibitors are also medication that can stimulate or can help your arterial circulation by giving some vasodilation in the arterial system. But we do not want vasodilation because they need actually vasoconstriction to maintain the blood pressure. So ACE inhibitors, I would not advise to use them because it may make the situation worse. Yeah. So I think maybe digoxin, maybe diuretics for a short period of time. That is the only thing we can do. Then we've used it in one horse, implantation of an occluder. What is this occluder? This is actually a kind of prosthesis that consists of two discs, and these two discs you try to put them over a fistulation or a rupture. Now, the biggest, we've only done this in one horse so far, and the biggest occluder that we could use was one of a diameter of 4.5 centimeters, so 45 millimeters. And you can see it here in the horse. We are trying to put this occluder in the middle of this rupture, and there is one disc here, and the second disc you can see over there. But we did not succeed in keeping it in place, and the reason was, so as it didn't work, we euthanized the horse. The reason why it did not stay in place was that this horse had a rupture of 6 centimeters, so there was no way that this occluder could stay in place. But theoretically, it is possible to use these kind of occluders. We don't know currently whether they are safe to use, whether, you know, if you implant an occluder, if the horse is then safe or not safe. If you can put it in a smaller rupture, in theory, it's possible that this occluder stays in place, that it's overgrown by own tissue, and that in this way the rupture can remain closed. But we have no data so far because we only used it so far in one horse, and this horse had a rupture that was too big. So this is a little bit the summary of you know, the horse when it's presented to you, when you are a horse owner, where you should look at, and what the most important clinical signs are that you can already look at, and what vets will do to do a diagnosis. Yeah. So I would finish off with my presentation here, and if anybody has questions, we can already answer them now, and then Veronique will continue with her presentation.
Yeah, we have a few questions here. Cornelia sent this question to me a few days ago, actually, because she couldn't attend, and her horse has recently been she's gone through an examination, and her veterinarian found a heart murmur, and she was curious, is this something that she should be concerned about? How quickly should she want to get this examined? Her horse is healthy. He doesn't have any physical issues, and she would like your opinion on heart murmurs. And I think it's in relation to aortic rupture. Is that, and I know you covered this, but if our horse has a heart murmur, should we look for more thorough cardiac diagnostics to see what's happening there?
Yeah, so the most important is that probably you should not be too worried at this stage, because when there is really a problem with aortic rupture or something that goes into that direction, we do expect the heart rate to be increased. When it ruptures, it will be increased, and the murmurs can be present, can be absent, so that's not a very typical thing. So the statistical chance that your horse has something related to a rupture is very, very small, and it's much more likely that your horse has a valvular regurgitation somewhere in the heart. But I do think that you should check it, yeah? But I do not think that you should be too worried that this is now the aortic rupture. I would, however, like to tell you a very tiny anecdote. So I've told you now about the hematoma. Yeah, the hematoma around the aorta, the fistula where we always look for, and now you mentioned this murmur. I can tell you that we had a horse that came into the clinic for evaluation of a murmur, and it was fully by coincidence. The murmur was caused by mitral valve regurgitation, so yeah, typical valve. Okay, yeah, it's something that is common. But as it was a Friesian, we always look at specific views, and we always look whether there's anything other abnormalities identified in the heart. And this horse actually had ruptured his aorta and had a pseudo aneurysm around the aorta, but it was not ruptured in the thorax, of course, but also not ruptured into the pulmonary artery. And so this horse was living with this rupture. It was still being ridden at that time, and it was examined by coincidence for a murmur that was unrelated to this rupture of the aorta and the pseudohematoma. So this was only one case that we identified like that, but this case indicates that there are horses, there are Friesians with a rupture, with a pseudohematoma that do not have very clear clinical signs. And that was very confusing for us because we thought that this was not possible, but the horse was still being ridden, and actually it was low-level exercise that they were doing, but there were no complaints. And we do sometimes get horses, so specifically Friesians with lower performance. We know that this is sometimes an issue in Friesians. So I do think we need to look for it, and we need to be more attentive to this disease and to identifying this abnormality. So again, for the question, very likely that it's not anything related to rupture, but I do think that you should check it. And specifically in any Friesian, where there is something cardiac related, there should be images taken to confirm, okay, and the aorta is fine.
Right. Benta asked, why does the heart rate stay regular instead of irregular?
Yeah, that's a very good
question. She
question.
also wants to tell you that she's a fourth-year student from Utrecht University.
Okay, super. Yeah, that's a very good question, because very often we get with all kinds of cardiac diseases and high heart rates, and we think about irregularities, and irregularities are usually because of ectopic rhythms, so ectopic electrical impulses that originate somewhere from the myocardium. And in these Friesian horses, actually, there is nothing wrong with the myocardium. It's all the vessel. So actually the heart is doing fine. It's the vessel, it's the aorta. And so therefore the heart will compensate for the problem, for the low blood pressure, low oxygen, and so on. And it will try to compensate to be quicker with the heart rate. But the heart itself is otherwise normal, and the activation of the heart is normal, and it is regular, and so on. So you get a high heart rate, but a regular heart rate, usually. Yeah.
We also have a question. These two questions are kind of related. Rodolfo is in Brazil. He's watching from Brazil, and he says that they don't have a lot of information about this problem in Friesian horses, and he wants to know if this is a genetic disorder or disease. And Anna also asked a similar question, if this is a genetic issue and if it can be passed down to offspring. I know we're going to cover a little bit of that more in the research, but
yeah. So Nick will cover more of that, and I think this is ongoing research. It is a very complex problem. We know that it is so specific for the Friesian breed, this rupture at that location, and we have to say that actually if you look at other animals, it is super rare to have a rupture at that location. Super rare. It almost never occurs at that location where it occurs in the Friesian horses. So we are pretty convinced that there is a strong genetic influence, but we do not know yet how it is. The hereditary process behind it, we don't know exactly how it is. We think that it is polygenetic, that you need different factors together before you get this rupture. And there might be environmental or management issues that are related to it. So it could be that you have a genetic predisposition, but you only rupture when there are additional factors in the environment or blood pressure, or maybe feeding habits or whatever that could play a role. And we don't know exactly how that works, but because it's probably polygenetic, that makes it more difficult for for example, for developing a genetic test, yeah, because that would be the ideal if you could test for it. So I think Fenway is also very supportive in all that research, and that is really super important and an essential part of it. but it's not easy. So it's not an easy task, but we need lots of data, confirmed data of confirmed horses, blood samples of them to be able to do this genetic research. Yeah.
Corinne from the UK asks about transesophageal ultrasound. She has read a presentation about that method of diagnostic, and she wondered if that is still used.
Yeah, so yeah, that's a good remark. So it has been, so we've done that in the past. The transesophageal ultrasound has also been done together with colleagues from Utrecht and Wolvega. So the problem is that the technique for transesophageal ultrasound does not exist in horses. Yeah, we have not, there are no probes that are long enough, that are commercially available to do this ultrasound. And so we've tried to develop tools to do this in living horses without cutting into the esophagus, which you should never do, because that is something very severe with a lot of complications. And it is just super difficult, and I would not recommend to look further into that. It's much more important to take the regular transthoracic ultrasound, as is done with an echocardiographic exam. But I need to say, special images are required to visualize the aorta and pulmonary artery, and it's not always visible on a routine exam. So I would really stress, and we also give, on conferences, we give presentations for veterinarians to adapt these new techniques to visualize the aorta and pulmonary artery. So that is something challenging in the Friesians, but I would not put too much effort into this transesophageal. It has been done like almost, let's say, experimentally in a number of horses to look for that, but it's really not my favorite. Go for the transthoracic. Yeah.
Okay. And for horse owners here, like in the United States or other countries, if they have a local vet who believes that there is an issue and refers them to a larger clinic or facility for more diagnostics, what questions can the owner ask these larger clinics or hospitals about their diagnostic equipment or the expertise of their team to ensure that they're taking their horse to a facility that can give them a thorough diagnosis?
Yeah, so I think it's important to already mention that the horse is suspected or should be checked for this condition, and they should then perform a thorough echocardiographic examination, and they can already indicate, look, it's a Friesian. I want to look for this aortopulmonary fistula, and so specific images are required to do that. The equipment will be available in most clinics. It might be useful to already indicate to the vet that it is a Friesian and aortopulmonary fistulation, so that they know that they should be able to take these special images, because it is often missed on the routine diagnostics. I think on the routine set of images that we take of the heart with a standard exam for a Friesian, we take different images in addition, specifically for this condition. And the second thing that could be asked, because these images are difficult, we realize they are difficult, and you need expertise to take them, especially because the Friesian is such a robust animal. But the second thing you could ask is that, in cases where it is difficult to get those images or to be sure about the diagnosis, you can always ask whether they have experience with cardiac catheterization. And this is something that is actually, it's not that difficult. You need some equipment to do that, but it is very, very useful to go into the pulmonary artery with this catheter, take blood samples, look for the oxygen and look for the pressure. And it is really diagnostic if you get the catheter into the right vessel. So that is also something that you could ask. Do you have experience with cardiac catheterization, if it is needed in my horse with a suspected fistulation?
And this last question is mine. Are there any printed resources or videos that we can provide to other veterinarians to help them know exactly how they should be taking these images for the best quality, as far as visualizing that area where they can make a thorough diagnostic?
Yeah. So we have this publication where these that I just mentioned during the presentation. There are video loops together with the online publication. There are video loops. There are different images available, and also very precise information on how you should rotate and manipulate your probe. So there is quite some detail in to get those images, and also video loops. So I think that should be quite helpful. And in case of problems or whatever, they can always mail me, or maybe it can be of help of identifying abnormal images, or to have a look at the images, if it's possible. Yeah.
Wonderful. Well, that wraps up the questions for this segment. So I think we're ready to move on to part 2.
Okay.
Hi, good evening. Thank you, Angie, also from my part and the rest of Fenway Foundation for the invitation. So the research part, and I will start with the beginning. So when we started in 2010 as a good PhD student, I immediately dove into the literature because I wanted to know, because at that time point, I think we had seen more or less 3 affected Friesian horses here at the faculty in Ghent. So I was trying to look up aortopulmonary fistula horses, and this was actually the only record that I could find, originating from 1985. But I was immediately interested because, as you can see on the left, this report described 4 3-year-old horses. And 3 of those horses were Friesian horses, and they showed the exact same lesions as we had seen. And more important as well, 3 of those horses, the 3 Friesian horses specifically, were descendants from the same sire. And no, I don't know the name of the stallion. It was not published, so I don't know it either. But this was a good start. And one of the main struggles that we had in the beginning, or our biggest fear, was actually is to get enough horses to be sampled. So we were a little bit concerned about that. And to be honest, we think that possibly there were a lot of cases missed in the past, because, as Günther already explained, you need specific echographic techniques. And also on necropsy, we have now evolved. If we see Friesian horse, then we already know what kind of cardiac incisions, and mainly to leave the pulmonary artery and the aorta intact, which was normally not routinely done. So we have evolved as well, of course. So as we wanted to find enough affected Friesian horses to be sampled, most of the participants probably know the members magazine Frieso, so they helped us. So we published a call out for the owners with some kind of detailed information already, what was the plan. And thankfully, so I want to immediately thank all the owners who trusted us and donated their horse to our research project. Of course, we did not do this alone, so we wanted to emphasize that this was a collaboration, especially this is, of course, hereditary Dutch breed from the Netherlands. So, of course, we had a nice collaboration with Utrecht University, Equine Clinic located in Friesland, Wolvega, and then Wageningen University was as well also involved. Then I think in the beginning, our most important aim was just characterizing the lesions, because, as I just said, nobody, or not a lot of people had heard about this condition. So we started describing the lesions and went along for that. And we wanted to get insight into the pathogenesis of this condition. So we wanted to find out how does it work? How does a horse get affected? With then our final goal to give also input for the genetic research. So starting from 27 until now on, we've seen approximately 25 Friesian horses with aortic rupture, but that was only in Ghent, so that is not Utrecht or Wolvega or other The rest of the world is, of course, not included, else it would not be such a big problem as well. No gender predisposition, so we mean by that geldings, stallions, mares, they appear to be equally affected. Median age of these horses was quite young, 5.7 years, so a lot of horses were only at the start of getting more physical exercise. The youngest one that we saw was only 1 year old, and the eldest 11 years old, so there was quite a wide range as well. Most importantly was that all of the cases that we saw had the same lesions, and that was specifically a transverse rupture just proximal to the ligamentum arteriosum, and we published this already in 2012. And so this was actually the first report that specifically called this a syndrome or condition specifically in Friesian horses, which was already an important big first step. Just a short recap, because I know Gunther already discussed this. So just ligamentum arteriosum, so it's just a small part of scar tissue that's remaining of the ductus arteriosus, so it has no functioning after birth, and normally in a normal horse it should close rather quickly after birth. And this is a picture, of course, of an aortic rupture. So just to give you a short kind of orientation, this is piece of the heart, this is then part of the aortic valves, and then you can see nicely here transverse rupture, which in the beginning we were a little bit surprised, but if you look at humans with aortic ruptures, or even in other animal species, transverse rupture is typically, and which you can also nicely see here. For instance, at this point, you can see that the intima, the innermost part, is a little bit fragmented, but that actually it's still part intact here, while this other layer is has already ruptured. Here, this was very important for us. So this is the little scar, this is the remnant. So this is the ligamentum arteriosum, which was close in all affected Friesian horses that we saw, because that was on all congresses or speeches that I gave in the past. This was the first question of mainly veterinarians that was present. Is it not just a patent or persistent congenital ductus arteriosus that stays open? So it was not, and for us, the only thing, it was actually used for us more as an anatomical reference point. That was actually all. So for the people who are a little bit sensitive, this is, I can promise, the most bloody picture that I have included in this presentation. But we did not want to let it out, because it demonstrates really nicely the periaortic hematoma or cuff that Gunther was already talking about, that you can sometimes also see nicely on echo. And this is also quite important. So the aorta has 3 layers: intima, media, adventitia. So in this case as well, we think there is first a rupture in the intima. Blood starts spilling into the aortic wall, and in the end situation, like in this case, the adventitia stays intact, and you get this massive periaortic cuffing of blood that runs onto the diaphragm. So this is the diaphragm of the horse. Here is then the liver, lungs, and the enlarged heart, and you can already see some spilling of blood in the thoracic cavity as well. And as you can imagine, this can cause a lot of pain. So no wonder why some of these horses create colic signs as well. Then this you have already seen before as well, presented by Gunther. So this is pseudoaneurysm or hematoma. And this is also nicely here. So in the beginning, we even called this pockets, because we actually had no idea. Sorry.
I'm just putting your laser pointer on.
Thank you. Gunther is helping me with my laser pointers. Thank you. So in the beginning, we even called this pocket because we actually had no idea. We had to dive into the human literature to find out, because again, this is rarely seen in horses or in any other animal species, actually. So this is the pseudoaneurysm. So this is normally filled with clotted blood. This is then the remaining of the aorta. So here are the edges of the rupture. And then here stays the blood within with some kind of turbulence. And as you can see here, this is an irregular and thick fibrous capsule. So it means that it has been there for quite some time as well. Then aortopulmonary fistulation. As you can see here, I did not want to leave this picture out as well. And here you can see above is the aorta. And then beneath is the pulmonary artery. Excuse me, and you can even see some lung tissue surrounding the pulmonary artery. And as you can see here, this is my finger, so I have my complete finger through the connection. So this is a massive opening and creates a lot of secondary symptoms. Günther already talked about, and he showed you already also the video of an affected Friesian horse with the pendant edema. So this is something that we, of course, also can see. So this is just buildup of fluid, extra volume of fluid in the subcutaneous tissue. And especially Friesian horses, as they sometimes have quite a lot of fat tissue, it's quite prominently observed in this case. An enlarged heart. And here also as well, lung edema. So you have to imagine these are very heavy lungs, filled with edema, filled with fluids, as we often say as well in human medicine. I know patients with cardiac failure, and then they talk about water in the lungs. Well, it's similar as in horses. And then here below is a picture of a liver. Normally the liver should have some kind of homogeneous color. And here you can see again, because of buildup of blood, we call it a nutmeg liver. So this is also something specifically, and these are all secondary lesions, secondary to the chronic heart failure that these horses develop. Then we proceeded with vascular casting. Why? Because it's a rather easy technique. And we did our very best, as you already observed, with the echographic pictures, also on necropsy, to make nice pictures, nice videos, but we were still struggling because even on necropsy, if you want to see the lesion, then you have to cut open the aorta, and what happens, the aorta just kind of flattens out on the necropsy table, and you lose more or less the 3D structure of the lesions. So we got some input from our colleagues from the anatomy department, because this is a technique that they often use. And it's quite easy. We got the complete lung, heart, and the aorta out of the thoracic cavity of the affected horse on the necropsy table. Then we flushed out, just with water hose pipe, we rinsed out all of the clotted blood. And then we filled both the aorta and the pulmonary artery with the remaining branches with silicone in 2 cases, because we had 3 affected Friesian horses that underwent complete necropsy, of course. And those 3 horses were used for the vascular casting. In 2 horses, we used silicone, and the other horse we used Technovit. That was the first case, but Technovit, it smells a lot. It's really not that safe as well. And I was pregnant at the time as well, so I had to be very careful. So once I was pregnant, we decided to go for a silicone casting. And this is the very nice result that we got. So this is the pulmonary artery, and as you can see, it subdivides into 2 main branches, and you can even see really nicely here all the small lung capillaries, because of course the lung is important for oxygen transfer. And here then you can see the aorta. And then we had a rupture at the ventral side of the aorta. And then this is part of the pseudoaneurysm. This is then another pseudoaneurysm. But of course, these pseudoaneurysms were also connecting with each other. And then we saw a connection with the pulmonary artery. And what was again very important that we saw in the 3 affected horses that we used for vascular casting, a consistent location at the exact same spot. So this was nice, not only for now. It's a shame that we're on a webinar, because if you would be live here in Belgium, then we could even pass it around. So we still use it even for students as well. Then we proceeded, because I'm a pathologist, we pathologists, we love to do histology. Whatever we see, we want to fixate it and do some microscopical examination on it. So for this publication, we gathered 20 Friesian horses with an aortic rupture. We did complete necropsy on it, and we performed not only histological, but also immunohistochemical examination at the level of the aorta, because it all makes sense. We first described in our first publication the macroscopic lesions and the clinical signs, and then we proceeded with how does it look under the microscope. And then if you remembered, so 3 layers in the aorta. The tunica media is the middlemost, is the most thickest of the layer, the thickest of the layers. And it's also the most important, also functionally wise. And you have 3 main components in the tunica media. You have the smooth cell, so that is the cellular component. And of course, these smooth muscles, they can contract. So they make it possible for the aorta to contract. So this is the cellular component. Then you have also the extracellular component of the extracellular matrix, which is also often used in scientific publications. And that means the elastin fibers, which are important for the elastic recoil, as Günther also already showed you with the aorta blowing up that was filled with air. And then we have also collagen fibers, and these are mostly important for the tensile strength of the aorta. So those are the 3 main components in the aorta. And if you look then in the affected Friesian horses, in this publication, we only describe the affected Friesian horses, but you have to be aware, we do here necropsies on a daily basis on horses. But as you can imagine, liver, lungs, heart, even brain tissue, those are standard organs that we take on a daily basis for routine histological examination. Aorta is not an organ that we often take because we don't see all that often aortic pathology. So we looked, of course, first at aortic samples from control healthy warm blood horses, because of course it is important to first get an idea what is normal before continuing to abnormalities. So if we compared control warm blood horse aortic samples to affected Friesian horses, we could see build of mucoid material accumulation. So this is the bluish material, as you can see here. Normally it should not be this prominently present. And both for the elastin fibers and the collagen fibers, you can see normally in healthy warm blood horses, you can see that they are parallel and regularly oriented in a nicely ordered fashion. And here we both saw fragmentation and disruption, both of the elastin fibers and the collagen fibers. So, and I have to mention again, but this was not very important, and this comes back later, the smooth muscle cells, so the cellular component showed some hypertrophy as well. But these are all things that we also, that also have been observed in human aortic pathology. So what was important, similar lesions were again observed in all affected Friesian horses that were included in this study. And most important, because now it seems obvious, but we saw no prominent inflammation. We saw no parasites, no bacteria, because of course this is important. You have to exclude if it's an inflammatory condition or not. And then taken together with that, all similar lesions were seen in those horses. This was suggestive of a genetic and possibly primary connective tissue defect, because again, we saw the fragmentation of the elastin fibers and the collagen fibers as well. Then we went a little bit further, and this was more a complex, more complicated research project that we did. Because in the previous study, we looked at the aorta at the level of the rupture, but then we wanted, of course, to see what happens if we look at the middle part of the thoracic aorta, and then not only in affected Friesian horses, of which we collected 20 again, but also in 18 control Friesian and 17 control warm blood horses. So those control horses were just horses that died or were euthanized for problems not related, of course, to the heart or to the aorta or pulmonary artery even. We used image analysis, which is more of a complex technique, and it actually means we already had the histo slides from the previous publication that I just presented. We took some digital images and then we used some complex processing techniques to get some more information. So this was kind of a time consuming. I spent a lot of time on the computer then, eating a lot of M&Ms as well. And as you can see here, control horse above, affected Friesian horses. And as you can nicely see here as well, we looked at the area percentages of the main components, and we could see here that there appears to be less elastin area percentages in the affected Friesian horses. And also, again, the smooth muscle cells appear to be enlarged. We call that hypertrophic, which could be something compensatory as well, because it's also seen in human pathology as well. We looked at several other components as well, which was the most important, the thickness of the media. So we just measured again using processing techniques on the digital slides. So we just measured the thickness of the media, both in affected, non-affected, and control warm blood horses as well. And what we saw was that the medium thickness of the media is actually thicker. So normal, healthy Friesian horses appear to have a thicker media. But what surprises a little bit, because as you could see previously, that the smooth muscle cells appear to be enlarged. So we thought maybe in the beginning that we would have a thicker media in the affected Friesian horses. We actually saw that the media was thinner. So maybe this was actually predisposing them as well for rupture. And what was also, again, an important thing that we found out was that both the affected Friesian horses and the non-affected Friesian horses, if we looked at the middle part of the thoracic aorta, that the area percentage of the collagen was increased. So this again, and I will go to the second point now because this makes more sense actually at this point. This again pointed out towards a breed-specific collagen disorder present in the general Friesian horse population, so meaning not only the affected Friesian horses with aortic rupture, but also the rest of the Friesian horses. And also breed-specific differences appear to be present if you look at the thickness of the media. This was not completely surprising because I found out that if we look at us, that apparently Africans, Europeans, and Asian people, if you compare them, then you can also see race-related differences. So apparently it also happens in horses. But that was interesting because it had never been looked at before. And what was also fact, beside of the collagen disorder that appeared to be present in all the Friesian horses, it is still possible that a supplemental elastin deficiency exists in the Friesian horses presenting with an aortic rupture. Then we went a little bit further with tensile testing because we wanted to look at the biomechanical properties, and we mean by that we wanted to check the strength and the elasticity. So that was the next step. We again continued with the similar 3 groups of horses. We collected for this publication 5 affected Friesian horses only, 10 control Friesian horses and 10 control warm blood horses. And these horses were sampled. So we got the complete thoracic aorta out, and then we took our samples at 3 different locations, so close to the heart at the level of the rupture actually, at the middle part of the thoracic aorta, and then far away from the heart, so at the level where the diaphragm is, so where the thoracic aorta actually stops. And we took both rectangular and dog bone shaped samples. I will show you a video next. It will look very easily, but thank God I had a lot of help from bioengineers, because I struggled for over a year almost, I think, to find people that had a lot of experience with it, to find clamps that were working. But in the end, it was nice. So you can see here, so it starts rupturing here, and then it goes on normally the video until in the end. And you could see already here, it's not like just crack and it's done. It starts with one layer in the inside, and then it continues on. I don't want to go too far in this topic, but what we found out and what was nice for us, because what we saw was, if we compared to different locations, so again, one was immediately at the level of the rupture, so quite near to the heart and the aortic valves, then middle part of the thoracic aorta, and then distal part, so further away from the heart. And what we saw in both, in all three groups actually, was that the aorta further away from the heart was more stiff and actually less strong compared to the others, which was nice, because this is what you actually expect, what has been published again in human medicine, but also in sheep and in dogs. So this just meant we did a good job. The bioengineers did a very good job. They helped us a lot. So our tests were working fine. But as you can already observe, we did not really see any differences if we compared the groups of the affected Friesian horses and the control Friesian and warm-blood horses. So we were a little bit disappointed. Is not the nicest word to say, but we were a little bit surprised, because we found no differences between groups. So this means, is it really just a regional defect? So just at the level where it ruptures, that it means that maybe this is just the weak spot, and that the rest of the aorta in the affected Friesian horses is maybe just normal? Or is it indeed a generalized defect, meaning that actually the complete aorta is abnormal, especially in the affected Friesian horses, but that because of compensation, for example, the smooth muscle cells that increase in size, maybe they are enough to compensate, so that we did not find any differences in the biomechanical properties. Very important to mention the limitation, as you can imagine. We had 5 Friesian horses with aortic rupture. And I think in 2 or 3 horses, I'm not sure about it, it was impossible for us because, as you can imagine, once the aorta has ruptured, then actually your predisposition spot, it has disappeared. And often the rupture was sometimes several centimeters long, which made it impossible to take a nice sample at that location. So that was a main limitation, of course. Then this was more a study at the end of my PhD, because I have to confess, by that time, everybody was talking about collagen disorder, and I was still not really convinced by myself. I was thinking we have to find some kind of way. So even I can really believe it. And then I found out a study as well in human medicine, which we then discussed, because in human medicine, they often look at excretion of collagen cross-linked. So normally the collagen fibers are cross-linked to get their normal strength. And in human patients, for example, humans that suffer from, for example, bone tumor, if you have a neoplastic process in the bone, then of course the bone will break down at that spot. You will also get catabolism or breaking down of the collagen. And in those patients, normally you expect to see higher excretion of collagen crosslinks. So we're thinking we can try this in Friesian horses. So this was called the urine article, and I have to confess a lot of colleagues were laughing a little bit in the beginning because we kept on walking around with a lot of jars filled with urine, and everybody was wondering what we were doing with that. And I think the hardest part actually of this was also receiving enough urine samples. My father, for example, spent many hours waiting for a horse to urinate to catch the sample, but it worked out. We collected urinary specimens from 17 Friesian horses, and a lot of these urine samples were also gathered while the horses were under anesthesia. So not all these horses died. 17 Warmwood horses, so they were all living well and or under anesthesia because they had some minor problems, or just standing out in the stable or outside. And then we proceeded with measurements of the collagen crosslinks. I will try to pronounce it once, but I'm still struggling with it. The pyridinoline and the deoxypyridinoline, and we were actually very nicely surprised because statistically it was very significant that if we compare the ratio of the pyridinoline and the deoxypyridinoline ratio excretion in the urine, then I think everybody can see that it was much higher in the Friesian horses, in the urine of the Friesian horses, compared to the Warmwood horses. So this was again suggestive of a high rate of collagen degradation in Friesian horses, meaning that perhaps they have a higher catabolism. We are not sure how it works actually, but again, it appears to be that the collagen was involved. If you compare them with other animal species, because Gunther already talked about non-Friesian horse breeds, if you look at other animal species, it is really very rare. We have seen it here also in our pathology department, but it's not something we see on a daily basis. Dogs and cats, some isolated case reports described in literature, that is actually all. More regularly, it has been described in high productive, mainly Holstein Friesian cows, the pigs, turkeys, some more animal species who are often used with high conversion, with rapid growth as well. And it is sometimes also associated then with copper deficiency. Why? Because the high growth rate that they can get deficiency of copper, and copper is very important for the cross-linking of the collagen fibers. But in those animal species, you expect to see a true aneurysm. So not something like we see in the Friesian horses with the aortopulmonary fistulation, but just to exclude it, we had 5 affected Friesian horses. We gathered some liver samples as well that we had stored. It's not that difficult or expensive examination. Just from 5 affected Friesian horses, we sent the liver to an external lab and the copper values were normal. So we did that just to make sure that this appeared to be normal. So to conclude, the final conclusions of the research project until now, a generalized collagen disorder. I was probably talking about increased collagen catabolism, so this is a little bit of a mistake, apologies. So a generalized collagen disorder is suspected in actually the general Friesian horse breed. Friesian horses do have a higher blood pressure. No differences found, however, in biomechanical properties. The Friesian horses with an aortic rupture appear to have a thinner media, which could probably predispose them. And as all animals that we saw both in Utrecht as well as in here and even in Wolvega showed a unique location of this defect. A genetic defect is highly likely in this case, and could be that the affected Friesian horses have a supplemental elastin or even other gene defect involved in collagen metabolism. Conformational changes, as you all can imagine, Friesian horses have such a typical conformation, such a typical appearance if you compare them to Warmwood horses. Gunther once said to me, if you would paint a Friesian horse completely white and have a white warm blood horse next to it, then we could all still see which is what is a Friesian horse and what is a warm blood horse. So they have different anatomy of the thoracic cavity of the sternum. So we did some preliminary study to try to, what we actually did was in situ. So we opened up affected Friesian horses, I think 5 in total during necropsy. We filled them with some kind of foam material that you actually normally use for insulation in constructions. We let it harden out, and then we got the complete aorta with the material out. We got it into CT scan just to look if the aortic curvature in Friesian horses was different compared to warm blood horses. So this was just small preliminary data, but we could not really see large differences if you look at the aortic of the curvature of the thoracic aorta compared to warm blood horses. So this was the end. So I'm patiently waiting for possible questions.
Yes, we have several here. This is kind of a general question, but how do we most effectively talk to vets who dismiss our concerns because they aren't as educated in Friesian-specific issues and risks? It's a very good question because, we often hear from owners that they'll take their horse in for something and they'll be told, well, it's just because it's a Friesian. Friesians have problems. They kind of dismiss the owner's concerns sometimes.
Yeah, that is, I think the most important is to address specific clinical signs. So we know that Friesians, for example, when it comes to performance, we know that there are Friesians that have a problem to have good performance. But I think for diagnosing the aortic rupture or aortic pulmonary fistulation, I think there are specific clinical signs that should be looked at. And if you have any of these present in your horse, like the tachycardia, like venous jugular pulsation or whatever, then I think it is very important to really stress upon this specific condition and to have it looked at. And in those reasons that are being presented to a clinic for a lack of performance, very often vets say, oh yeah, it's a Friesian, yeah, that's typical, we don't have to look further. I think you should emphasize that you want to eliminate that this potential risk could be present. And I'm referring again to this one case that we had. It was only one case, but still important, I think, where we really stressed to the owners, look, this horse should not be ridden, and this is really this can really be a risk for the horse and for the environment. So I think you should really specifically address that point.
Janet asks, do you think that a high-dose collagen supplement is a good idea of a constructive protective management or treatment policy for this type of disorder?
No, because as far as I'm aware of, if you would give it orally, then it will just be excreted. It's something that has to be built up by specific cells that are in the entire body, not only in the aorta, of course, but also in the tendons, bone, eyes, everywhere. Actually, you have collagen everywhere.
Yeah, we get this question a lot, and I think, you correct me if I'm wrong, but it's not that there's not enough collagen, that there's a lack of collagen. It's that the collagen is not correctly organized or structured correctly. It's not produced correctly, and that's where the genetics come into play. We don't know what's causing that, but it's nothing that we can just feed an oral supplement that's going to fix this issue. Correct?
No,
yeah,
correct.
it's very unlikely.
She also asked another question. Do you think that perhaps a glucosamine, HCl, or chondroitin sulfate supplement would be advisable?
Yeah, I think it's a bit of the same issue as we just mentioned. So it is really a problem of this building up of the collagen. It's of abnormal structure, abnormal strength, and it's very unlikely that these products do influence that. So it's more a metabolic disorder, and it's not a deficiency, or it's not a lack of certain ingredients, let's say.
Gil asks, do you do blood tests for smooth muscle antibodies?
We don't.
No.
No.
No, never actually heard about that.
No.
I do think the cardiac troponin, but I don't know actually. Yeah,
so
maybe that is interesting to
yeah,
mention.
so for the blood test, I didn't really go deep into that, but for the blood test, we have so we've checked the cardiac troponin. So cardiac troponin is actually a marker for cardiac damage. Now, this can be increased in Friesians that have a rupture of the aorta because the heart suffers, let's say. It has a high heart rate, and so it is possible that this high heart rate induces increases in the troponin, but no increase in troponin does not mean that there cannot be an aortic cardiac fistula. So it's actually more a detection of a secondary effect of that, and it's not a primary problem. It can, however, help when you think about a cardiovascular problem to check for the troponin. We also checked in only a limited number of horses for D-dimers, and D-dimers are products that are related with coagulation, so blood clot formation. And in some regions, we've seen that they had higher values, probably because of blood clot formation located in those pseudoaneurysms. But it was, it's not really specific or diagnostic, and it can sometimes be a tiny bit of a help, but it's not a primary problem that you identify. We also checked horses for other parameters in the blood that were non-specific. Some of these horses had increased white blood cells, some didn't. Some horses had increased SAA, which is an inflammatory marker. Others didn't. Some horses had increased gamma GT values. Gamma GT can be increased when you have a liver congestion. But again, these are secondary aspects, not really primary. And in some horses, they might be increased or moderately increased, and in others not.
Hanukkah asks, do you think the urine test that you mentioned may have clinical relevance? I kind of know where she's going with this. Is this a diagnostic tool that could be developed in order to, say, a horse may have a predisposition?
I think no, because we saw it in all Friesian horses that it was elevated. We saw some variants as well. And you have to imagine collagen, as I just said, it's present everywhere. So I think if there would be like heavy tendon injury, then it would probably increase as well. So even if you would see an extra increase compared to the normal Friesian horse population, then it would still be aspecific. It could even have a bone tumor, which is really unlikely in horses. But so that's also why we did not even, I think maybe we tried it in one affected Friesian horse, and it did not even show that high level. So it was just for us to compare normal appearing Friesian horses to healthy warm-blood horses, but not for diagnostic approaches.
Yeah, I can tell you that we, the Fenway Foundation, explored it as a potential just to see if we could develop a diagnostic test for it. And we spoke to several different laboratories, IDEX being one of the main ones. And it was just very cost prohibitive to develop this test. It was going to be upwards at that time, this is a few years ago, more than $40,000 or $50,000 just to develop the test. And then we weren't even sure that it would be, elevated in horses that were affected with megaesophagus, for example. But yeah, it's a good question though. Janet asked about copper deficiency. Are you saying again that there's nothing that we can feed in any way that would help, or perhaps even something like vitamin E? And if there's nothing that the owner can do, then are you suggesting that we merely keep them at their lowest stress situations for the remainder of their lives?
Yeah, so for the copper, I have to say, so we've only examined a limited number, and very important to know is that when you measure copper in the blood, for example, it's not a good representation of the copper in the body. So we have to say that we have limited data on that, but so far we have no indication that there is really a copper deficiency. We also see that in other animals that do present this aortic rupture with the copper deficiency, it often first leads to an aneurysm that then ruptures. And this is not the case in Friesians. They do not have this aneurysm. So therefore we think that, yeah, it's not that likely, but we lack that data. And we also lack clinical studies, like blinded clinical studies where we give copper and not copper. And the problem is that you do not know beforehand whether a horse will develop this disease in future or not. So you might be giving copper and say, okay, yeah, we are now 2 years down the road, but yeah, does this then prove that copper helped it or not? So currently we cannot predict which horses will get a problem and which not. So it's very difficult to set up a study or to look into these data. So we do not have a proof that it helps. We also do not have a proof that it doesn't help. For the vitamin E, I think vitamin E is more related to muscle. It's not so related to this wall of the aorta, so it's unlikely that this would change anything. And then should we then keep the horses calm for the rest of their life? I think if you have a normal horse and there is no problem, you don't have to do anything. I mean, you can just carry on and. So we don't have to panic and think that all horses get this aortic rupture. That's actually not the case. But if you would have a horse that has a rupture or a pseudoaneurysm that has not ruptured yet, then I think, then you have to be very careful. You have to keep these horses calm. You have to be very careful also as owner or caretaker of this horse, because that is a risky situation. But I think the horses that do develop this aortopulmonary fistulation, I think there you have to think about the quality of life. If these animals survive, is the quality of life okay or not? That is, I think, important. And there's nothing with feed supplements that is likely to alter the disease process. But I think if these horses, let's say, are chronic and stable, but they have persistent tachycardia, edema, they get higher liver enzymes and so on, this is a progressive disease, and you have to look for the horse, for the benefit of the horse, to see whether they have discomfort or not.
Carly asked if we have a horse with a chronic aortic rupture, like a fistula, is that a case where the horse might live for days or weeks or months or years, or what's the average life expectancy for chronic aortic rupture?
Yeah, so a chronic rupture, and then actually we think about, if it's chronic, we think about two possibilities, or it is this rupture with a pseudohematoma like the case that we saw in clinic. That horse is still alive. We diagnosed it, I think now 1.5 years ago, and the horse is still alive and is doing fine. Yeah, so I think as long as it is this pseudohematoma, pseudoaneurysm, I'm using the wrong terminology, pseudoaneurysm, yeah, this hematoma around the aorta that stabilizes. And if it stabilizes, then usually you get some fibrotic capsule around it, and then it may become firm and it may stabilize. Then this horse is more likely to not suffer from the disease and to remain stable, and could potentially survive for a long period of time. But I think you should be careful with those horses, and you should try to keep them calm, not too many stress. You want to avoid high arterial pressures, because it might burst because of that. So that is a specific situation. If you have a horse with an aortopulmonary fistula, then you have this connection towards the pulmonary artery. Then everything depends on the diameter of the fistula. Yeah, if it is a small diameter, it will be better tolerated compared to a big diameter. Then you have huge pressures. these horses will start to develop right-sided heart failure and edema everywhere. So ventral, but also fluid in the thorax, fluid in the abdomen, edema of the intestines, sometimes diarrhea that we see. So these horses, we've seen that they can survive for months, but often then they start to deteriorate, and we have no exact figures of how many months or how long, but it is very likely that these horses will develop fatal heart failure, and that this is a slow progressive disease over weeks or months of time. But I think it is important as owner, if you have this kind of a horse, I think you should, I think the life quality of the horse is essential. We need to look for that. We need to look whether these horses suffer or not. In humans, it's known that when you have this kind of disease, it gives you a headache, or it gives you you are like weak and dizziness and so on. So I think we have to look carefully, is the horse still okay or not? And that is important. But they can survive for months, yeah.
And do you, as a veterinarian, would you typically recommend to the owners to consider humane euthanasia upon receiving this diagnosis, given the expected quality of life for these horses and the time frame? Is it more humane to make arrangements more quickly than slowly to have their end of their life be as good a quality as it could possibly be, versus, you know, carrying on until the horse finally, you know, passes away on its own?
If it is, so we're talking again about this aortopulmonary fistulation. We know that when there is a considerable communication between these two vessels, so characterized by the start of right heart failure, jugular pulsation that you can see in the neck, ventral edema, and so on, then we know this will be fatal. Yeah, and it can take a longer period of time, and in some horses it goes quite quickly, but it will in the end be fatal. And I personally think, but that is my opinion, I think, so we will definitely look further in the clinic. We will look further into these possibilities. Can we treat these horses? Can we put an occluder in or not? Because that could be, for some, could be maybe a solution, but we have to be careful. It is well possible that we put this kind of an occluder in, and that there is further rupture of the aorta, or that it's not being, you know, encapsulated in the process, and that it does not resolve. We do not know. So I'm not pretending that this is the solution. We will explore further, and we will try to find a solution and see if this works or not. But otherwise, I think if there is no occluder implanted, then there are very little possibilities. Also with medication use, there is very little you can do. You can give a little bit of diuretics, and that's probably it, and keep the horse calm. Then I think, and that's my opinion, then I think the horse should be euthanized before it goes downhill. I always tell owners, look, so I think if you keep the horse too long, and it goes downhill, and it's a bad quality of life, you keep the horse alive for yourself, not for the horse. And that's my opinion. Yeah, so I often tell owners, look, you have to think about the horse. If you love the horse, it's better to euthanize him when he's still okay, and that is not, you know, going downhill and having discomfort and so on. But I would like to stress again, make sure that you confirm the diagnosis, and that you are sure about the diagnosis, because it can be challenging. We've got horses from other universities, from other big clinics and so on. It can be very challenging in some cases. So I think you have to stress upon the real confirmation of the diagnosis. And if you have confirmed that, then I think you should not wait too long to stop. Yeah.
Karen asks, is there any evidence in Friesians or other animals that there's an enzyme deficiency or abnormality that prohibits the copper from getting into the cell or being utilized?
Yeah, I can answer. There is no evidence for that. So there's no evidence. So we don't know what the precise mechanism is. We have bits and pieces of the puzzle, But yeah, that's why we are so glad that this now comes under attention and that we can share this information. How far are we now? But there's still a lot of work to do, and there are still lots of important points that are missing.
Mahmoud asks, from your experience, what is the estimated prevalence of aortic rupture in Friesian horses? Great question, $1 million question there.
Yeah, that's a good question, because we have to be honest. Once at the end of the project, at that time point, we started seeing less of affected Friesian horses because, yeah, probably it is more well known now or there are more first-line veterinarians already
that make the diagnosis.
Yeah, that make the diagnosis, or
yeah.
So we actually see less cases the last years.
It did get more attention.
Get more, yeah.
Yeah, I will say that's true. We were talking before the webinar started that we're seeing more cases where it's not a finding on a necropsy where the owner's starting to notice these symptoms. There's a little more education out there now, and horses are being identified earlier. And so there is a definitive diagnosis. So that's I think a positive thing.
Yeah, and you should, I think, for every horse then do the right complete echographic and complete necropsy to make sure that that was not the case. Else.
There's also another question. Is there any connection about the intellect of a horse and this disease? I hope I'm pronouncing that right.
Until the inheritance. He's more a clinician, I'm more a pathologist, so we are no genetic experts. So we leave. I think most of the members know that there is an ongoing genetic research going on. By KFPS, also with Wageningen University, with Bart de Croo and Marije Steensma, where they are also looking at the pedigrees as well, looking at inheritance. But actually,
right? That was the question she was asking about the inbreeding rate. Is that correct?
Inbreeding rate,
okay.
Yes.
Okay.
No, but we did not do such kind of a thing. Look at the pedigrees and the inbreeding rate. No.
Fairfield says, great. He said, awesome presentation. I hope more veterinarians are aware of this and have this in mind when presented with Friesian showing signs consistent with the problem. Thank you both very much. Ken asked, if my horse passes away and I think it could be aortic rupture, how can I confirm that?
If it has already passed away, yes, or necropsy, I think, once it has died, you should possibly send it. If you have, and that's more important, especially for the Fenway Foundation as well, from as soon as you have any suspicion, please ask, especially before euthanasia, especially your veterinarian, please take a blood sample and then send it off for necropsy, because we need confirmed cases, of course, for genetic research. That is very important.
I just would like to highlight, and Veronique also mentioned during her presentation, but the aortic, so the aorta and the pulmonary artery are actually a little bit curved around each other. And if you open the heart in a routine manner, you have to be very, very careful how you do this. And you have to, I think you have to really look inside these big vessels. And when you cut it open, you actually have to, for example, and correct me if I'm wrong, look inside the aorta and cut it open towards the heart, avoiding that you cut inside the aorta and make lesions yourself. I've seen pictures of autopsy where they mentioned, oh yeah, we did an autopsy and it was not a fistula. Where you said like, yeah, but what is this lesion then? Which is exactly on the point where I expected to be. Oh yeah, we thought that this was from our knife, that we touched something and that we made a lesion. And so it is very, very easy to be a little bit confused about the autopsy. And I think you have to really be careful and cut from distal, away from the heart, in the aorta, palpate and feel, is there a lesion or not, and cut outside that lesion, and do the same for the pulmonary artery. Because the fact that they are curved around each other often makes that you cut it open, and then you will lose the information. I think the one that does the autopsy, and of course institutes that always do autopsy, then it's easy. But if you do this, for example, separately or in a clinic or somebody that's less experienced, then they should pay really attention to that.
That's an excellent point, and we often have to ensure that when we're coordinating with pathology labs, we often have to tell them, you know, this is a suspected aortic rupture case. Be very careful where you make your incision, because that's exactly right. And of course, Dr. Sign knows, but I mean, where they normally make that incision could destroy your evidence, essentially.
Yeah, that's a very important point. The normal way you do an autopsy can destroy the really important area.
And normal necropsy even just cut out the heart with maybe 2 centimeters of the aorta and the pulmonary artery. So then you completely miss it, which probably happens more than a few times in the past.
Barbara, she says, this is an excellent presentation. Have you seen other connective tissue disorders in Friesian horses, such as megaesophagus, affected with aortic rupture? So I can answer that if you
combination. Yeah.
Hello, Barbara. Nice to see you. So far, the cases that we had here did not have the combination. So we had or the one or the other. So it seems to be different disorders, but we have to say that, yeah, potentially they are all like connective tissue disorder related. Also, the megaesophagus is something about, you know, the esophagus doesn't have its normal elasticity and becomes too big, or contractile function or whatever. The same goes for retained membranes. We see more retained membranes after birth in Friesian horses. This is also an involution of the uterus, which involves, like, you know, connective tissue, elastin, contraction of the uterus. So we could all explain it a bit as connective tissue disorder, but we did not see specifically the combination. Also, so in human medicine, you have disorders like Marfan syndrome. So people with Marfan have very flexible joints, which is also the case in Friesians. So they have also these aortic abnormalities. Friesians also have aortic abnormalities. And I also always find it striking, it's maybe a stupid remark, but Friesians often have this sternum that is quite visible. It's the same in humans with Marfan. That is one of the characteristics, that they have a sternum that is a little bit more towards the front. So there are quite a lot of things that are really the same. And also people with Marfan have a different, like, body posture. And also Friesians, that's what I mentioned with paint a Friesian black. You can see from very big distance that the conformation of the horse is very specific and is also different. So there are so many similar points that there has to be. It's really
But in the Marfan and the Ehlers-Danlos, you normally expect an aortic aneurysm, which we again do not have. So this is different again in the Friesian horses.
Yeah, I could say that in just collecting these cases for megaesophagus, gastric rupture, and aortic rupture, there are these unique alignments with human connective tissue diseases. But as you know, the genes involved in human genetic diseases don't always transfer to horses. So we have explored all of those syndromes, and they're very complicated. Some connective tissue disorders have 20 or 30 gene variants involved in them, and some of them do not have the same inheritance pattern. So it's very complicated. So we are chasing all of those leads, and we do see a lot of clinical evidence that the disorders may be connected under a broader connective tissue disease, but we have to do the genetic work to prove all that out. There's a lot of signs that could be the case. That's a good working theory, but you have to have the scientific facts to back that up. So Anita asks, is it still important to have rapports and echo from affected horses found out, in which special bloodlines it's more often than in others? Do you need a DNA profile from the affected horses? So maybe that's a question for me. Yes, we do need DNA. We've collected quite a few cases since we've started, our projects, and we're working actually with Ghent to get access to some of their samples. But we do need samples. Samples for aortic rupture cases are very precious, and I think they're extremely difficult to find, and that's because oftentimes, the horse might pass away and a necropsy isn't conducted, and so there's no evidence that the horse was affected with this disease. So we really are actively looking for DNA samples. It's going to take us, I think, a fair bit of time to collect the samples that we need for the project, and we're still in the phase of collecting samples. So my speech to everybody out there that's listening is that necropsies are important. I think they're important for the owners because it does give you a little closure to know what happened to your horse. It can be very unsettling when you don't have answers. And then you also have the opportunity for your horses, unfortunate passing, to be an opportunity for them to provide a final gift with that necropsy. It helps us collect data. And in the case that a horse is affected with a potentially genetic disease, that horse may just have, that, final answer that we need in their DNA to unlock some of these disorders. So it's necropsies and collecting DNA are very, very important to progressing this research further. And I think that is our last question. So as I'm wrapping up here, we want to really thank you both for taking so much time. I know you're both very busy, and you've had a long history with collecting all of this data and information, and it's wonderful that we can bring this to Friesian horse owners so they can be a little more informed about this disorder. So on behalf of the Fenway Foundation for Friesian Horses, we want to, thank everyone out there across the world that has listened to this webinar. If you find yourself having additional questions once this is concluded, please submit them to us, or you can contact Dr. Sein or Dr. Van Loon directly. If you want to pass them through the Fenway Foundation, our email address is info@fenwayfoundation.com. We will make sure that they get sent for a response. And if you had to leave the webinar early, or if you missed part of it, we did record it, and it will be added to our website before the end of this week. And anyone out there that registered will also get an email with a direct link to the webinar recording. So you can view this webinar and explore the other educational resources that are in our library by going to our website, which is www.fenwayfoundation.com. And again, thank you all for being here, and we look forward to seeing you at the next webinar.
And thank you very much for giving us the opportunity to contribute to this webinar. It was a real pleasure for us. Thank you.
Indeed.
Thank
Thank you.